All right, for today's deep dive, we are tackling a big one, OpenAI's newest announcement.
ChatGPT Health.
Exactly. And this isn't just some small update, it's a whole dedicated feature, and it's aimed squarely at, well, some of our most personal information.
And the scale is just, it's pretty wild.
It is. The sources we've looked at show over 230 million people are already asking health questions on ChatGPT
Every single week.
every week.
Yeah.
So this product is really a response to a demand that is already there. Our mission today is to unpack what this is, what it promises, and crucially, the warnings that come with it.
So the first thing to understand about ChatGPT Health is the architecture. It's all about separation.
Like a walled garden for your health chat.
Exactly. A ring fence. It's designed as a completely isolated space, so your sensitive health conversations are kept separate from all your other, standard chats.
Okay, that makes sense. A security baseline.
It's the absolute minimum for handling this kind of personal data.
But wait, if it's completely ring-fenced, how does it maintain context? The example they gave about marathon training. That seems to cross the streams a bit.
That's a really sharp question, and it's a critical distinction. The system maintains context, not the confidential health data itself.
So it knows I'm a runner, but not my cholesterol levels from another chat.
Precisely. And the CEO of applications, Fujisimo, was pretty clear about the motivation here. She positioned this as a direct response to, well, existing problems in healthcare.
The big ones. Cost, access.
Right, crippling costs, doctors who are overbooked, 6-month wait times for a specialist, no continuity of care. I mean, if your doctor changes every year, an AI that actually remembers your history starts to sound pretty appealing.
And that marathon example really brings it home. If you've been talking about training in your regular chat, the health section knows you're a runner when you bring up, say, muscle soreness.
It connects those dots. It pulls in that surface level context to be more useful without, breaching the core health data silo.
Okay, so let's talk about that data, because this is where it gets really ambitious. It's not just about conversations, it's about integration.
Yes, connecting to your existing wellness world.
The sources specifically call out some big names, Apple Health, Function, MyFitnessPal. So it can pull in your actual medical records or your fitness app data. How does that even work securely?
Well, all signs point to a secure opt-in API integration. It has to be.
Meaning you have to explicitly give it permission.
You have to grant permission, and that transfer has to be encrypted. But the key part is what happens after the data is in the system. And this brings us to OpenAI's single biggest promise.
The training data.
The training data. They state very explicitly that they will not use health conversations or any of that integrated data to train their models.
That's a huge deal. That's the foundational promise for anyone worried about privacy here.
It is, but that shifts the problem, doesn't it? It moves from a question of privacy to one of fidelity. Can you actually trust it?
Right. Can a machine that's built to predict text actually give correct medical advice?
And that's the fundamental challenge. An LLM works by predicting the most likely next word. It doesn't have a concept of truth.
Which is where hallucinations come from.
Exactly. It can generate something that sounds incredibly plausible, even authoritative, but is just medically wrong.
But hold on, what about those studies we've seen? The ones showing that some fine-tuned models can actually outperform doctors in certain diagnostic tasks. There seems to be some real utility there.
There is utility, but that's the legal tightrope they're on. The potential is there, but the reliability isn't guaranteed. And that's why OpenAI has to protect itself.
The disclaimers.
The disclaimer, it's right there in their terms of service. Our sources highlighted it. The AI is, and I'm quoting, not intended for use in the diagnosis or treatment of any health condition.
So legally, it's a co-pilot, not the doctor.
It can't be the doctor.
So we're left with this real tension. On one hand, you have this massive, clear desire for easier, more continuous access to healthcare. And on the other, you have the very real risks of using a predictive AI for something as critical as a diagnosis.
A huge trade-off.
And that brings us to the final thought for you to mull over. When you see a number like 230 million people already turning to this technology every week, what does that incredible demand really tell us about the state of traditional healthcare today? And with the company's own stark warnings in mind, what trade-offs, really, will people be willing to make for the sake of convenience?